Peter Block at TCT 2015 for On the Scene. And with me today is Dr. Giora Weitz from Jerusalem, and he is the primary investigator of a trial called the River-Pci. So, Giora, tell me about River-Pci, ranolazine after percutaneous coronary intervention. What was the trial about?
Thank you, Peter. Thank you for having me. The trial of River-Pci was about patients with incomplete revascularization. We know that this phenomenon that we operators don't always open all blockages in the coronaries is very common, happens between 20 to 80%, depending on the series and the definitions. And those patients do not do well. They are coming back more often to the hospital, they're having more revascularization, and in some series they've even increased mortality. So we thought to do something different, to see if in those patients that end up with incomplete revascularization, maybe adjuvant pharmacotherapy can be of a benefit. We selected ranolazine, an well-known anti-ischemic medications, and we randomized 2,600 patients with incomplete revascularization, so it was a post-PCI study. We randomized those patients to ranolazine, 1,000 milligrams twice daily, or placebo. And we followed those patients, all the patients were followed for at least 1 year, or until there will be enough primary endpoint. We calculated to have above 700 primary endpoint. And we defined the primary endpoint of River-Pci as the time to occurrence of ischemia-driven revascularization or ischemia-driven hospitalization.
So let me just interrupt and ask you, did that include patients that had CTOs?
So yeah, that was a very coronary artery disease sick patients. Over 90% of the patient had multivessel disease. Over a third of the patient had untreated CTOs. And 14% of the patients were post-CABG. So really sick patients.
Okay, so basically a wide panoply of what coronary disease can be in patients. All right, I guess the next question has to be, what did you find? Ranolazine versus placebo, I assume, or ranolazine, no ranolazine, and it was randomized, correct? So what did you find?
It was a randomized double-blind control study. The event rate of the primary endpoint with placebo was 28%, and with ranolazine it was 26%. So basically we found no differences between ranolazine and placebo in patients with incomplete revascularization. We found also no differences in the individual component of the primary endpoint and in multiple secondary endpoint, and also no differences in pre-specified subgroups for the primary endpoint. Basically the study was neutral, negative.
Okay, but a disappointing study, all negative studies are a little disappointing, but there's always something to be learned. So for the clinicians out there, for the guys that are taking care of patients, I use ranolazine all the time. And some patients get better, some do not. So what's the take-home message you would like to put out there for everybody watching?
So, despite the negativity of the study, the positive news here that we learned a lot about patients with incomplete revascularization. Basically, it's the first study ever that prospectively evaluates patients with incomplete revascularization. And we have learned that indeed, what we thought to be true from retrospective study, we know now for sure, also in prospective study, that those patients are not doing well and they have very high event rate. We have learned that ranolazine is not the solution for that. Doesn't mean that ranolazine is not a good anti-anginal medication. It still is. It's not what we were testing. And we need to do something better for patients with incomplete vascularization. You may ask me what it is. And my simple answer is that to do better what we are doing so far, to do better secondary prevention, better to treat atherosclerosis, and maybe the solution is, and that's not what the study examined, but maybe that will be the next study, is to better treat the patients. So not to leave CTOs behind, not to leave small unrevascularized vessels behind, and to do a better job, complete the revascularization.
There you go. So complete revascularization seems to be the way to go. Thank you very much, Giora.
Thank you.